Thanks for staying with us. In 2021, nearly 40 million Americans were living with diabetes. Now in Georgia, the state says nearly 1 out of 8 people have it.
Insulin is known as a life-saving medication, but healthcare advocates say it has been unaffordable for those that need it most. Cecily Stout spoke with a pharmacist and a woman living with diabetes to hear how they say a price cap is making a difference.
You didn't do anything to deserve this. It's sad that you're struggling to stay alive.
Haley Melvin has lived a life with insulin since her type 1 diagnosis at 18 months old.
Insulin is expensive, insurance is expensive, and there were times like my parents were really pinching pennies to make sure that I got what I needed.
People with diabetes have been fighting more than the disease. One pharmacist says the price of their life-saving medicine forces some people to make difficult decisions.
It wasn't affordable at all. Some people's insulin need costs them more than the rent money.
Bonaire pharmacist Parth Patel says many diabetics struggle to pay for their insulin pens. Diabetics have several ways to give themselves insulin, but Patel says the pens are a popular option. One box of insulin pens on average has a month's supply of insulin.
For a whole box, it would be anywhere from $300 to $400.
A report by the American Diabetes Association says the cost of insulin increased 24% from 2017 to 2022. And the spending on insulin has tripled in the past decade to $22.3 billion in 2022. A 2020 survey found that 1 in every 4 type 1 diabetics ration their insulin because of the price.
They would start cutting their dose in half to last you until they get that money to buy the insulin, and then those patients would have high glucose for the last few days of their therapy.
High glucose can lead to dehydration and hospitalization because diabetics don't have enough insulin or their body isn't using it properly. Melvin says she's always tried to be responsible and be on top of her insulin to avoid hospitalization.
If you don't take care of yourself, you're going to a hospital. Or you can make it even scarier and be like, if you're not taking care of yourself, you're going to lose your limbs, your organs are going to stop working. That's terrifying.
Then in 2022, Congress passed the Inflation Reduction Act. It contained a cap on major manufacturers' insulin prices, and that cap took effect in January of last year for seniors on Medicare. Patel says it's already having an impact. Long-term insulin pens like these now cost under $100 for people without insurance. For insured patients, the price varies based on your copay and deductible. Now, Patel says the manufacturing price cap for insulin pens will help improve healthcare as more people are getting diagnosed. According to the American Diabetes Association, more than 38 million Americans were diagnosed in 2021 alone.
It was a step in the right direction.
You need it to survive. I feel like it should be treated like an over-the-counter drug and a lot easier for people to access, especially people like me.
Cecily Stout, 13 WMEZ News.
If you are struggling to pay for insulin, Patel says coupons are offered for certain manufacturers.
You can talk to your pharmacist to see what those options are. State lawmakers are pushing to make insulin more affordable for low-income patients. 2 House bills introduced this year would create a new program that acts as a safety net for patients. The program would provide up to a 90-day supply for less than $75. Both bills are sponsored by Democratic lawmakers, including Representative James Beverly from Macon.